People accessing sterile syringes, also fentanyl testing strips, overdose prevention.
Distilled water, caps, the bands, those that inject from someone else's needle. That's where you get either abscesses or contract HIV, Hep C.
These services provide a space for folks to, sometimes for the very first time, have conversations about their use in a non-judgmental environment.
We provide referrals and resources for programs that participants may prioritize as a need. So in Boulder County, we have a coordinated system for services for people experiencing homelessness. So these programs are just critically important for serving, I think, some of the most vulnerable people in our community.
And actually, we see decrease in use among people who access our services.
I think we've been fighting this war on drugs for a number of years, and we're still kind of at a standstill, and the opiate epidemic and crisis is still persisting.
People who have mental health and substance use disorders need medical and public health responses.
These activities would be happening with or without us. We know that people are passing away in alleyways, in bathrooms, in businesses, not in heroin as well. We're seeing it in methamphetamine, we're seeing it in speed, we're seeing it in cocaine. We've even had it show up in marijuana. Important for us to give out these fentanyl test strips because it's already an unregulated market of substances that our clients are often doing, and so they can take that extra step of testing.
Over 70% of people seeking methadone had transitioned to heroin after prescription opioids. So
There's not been one person who has died of an overdose in any safe consumption site or safe injection site.
An individual would come to a safe injection facility with their own substances. They would only be provided with safe injection equipment.
We are not encouraging or propagating the activity. We're making sure that it's being done as safely as possible.
The main thing is not that people need naloxone to reverse an overdose, but that they need just oxygen. A lot of times people, if they slump over after an injection, all that they needed to do to help them was to just like clear the passage, the breathing passage, and provide a little bit of oxygen. Their body is physically dependent in the same way that a diabetic is dependent on insulin. Having someone stop cold turkey, yeah, it's going to be very person by person, but it can cause severe physical reactions up to death.
People can't recover if they're dead.